Hi there, this is Dr. Erica here to talk today about some of the important differences between affirmative work with trans youth and affirmative work with trans adults. Sometimes all the issues with trans people are lumped together as though it's a homogenous group, everybody's the same. I can assure you, as someone who's seen many, many hundreds of trans people, all ages, that we're not all the same and we don't all have the same needs. One important issue that's come up in recent years is that older trans people who came out maybe in adulthood or didn't step forward for care until they were well into adulthood have experienced some trauma and are really disturbed by the fact that they didn't get care when they were younger. And unfortunately, this permeates some of the discussion in the media and in social media by trans people who want to say that everybody should get whatever they ask for. While the predominant model of care for trans people who are adults is in fact informed consent, putting few, if any, barriers in between the person presenting for care and what care they receive, we can't quite operate the same way with trans youth. With trans youth, we have a whole series of issues in terms of development, in terms of discontinuities in terms of areas of development, cognitive, social, psychological, and so forth. And we have an important job to do in trying to figure out how any of these might be related one to another. And so the model of care that most of us practice is gender affirmative care that provides an individual assessment for every child and family and seeks to achieve consensus about what's true about an individual child as the basis for making decisions about what to do. We also have, in the case of a child, whether young child or teenager, the issue of parental consent. So it's important that all of us who are doing this work understand that we want to get everybody on the same page. We want to make sure that everybody shares the same understanding about a young person at the same time. We don't all start out the same. Not all parents come to accept the differences in their children at the same time. And so we may have to have more conversation and do a little more work to get at this to the same place at the same time. But it's important that young people feel affirmed and supported during this period of processing and exploration. And that's my hope for all of you, that you recognize that there's a lot of chatter in the media about, getting trans people what they need. And I'm all there. I'm totally supportive of that. But children, even teenagers, are not just little adults. They need the support and care of their parents. And it's our job as parents to watch out for our kids. So let's have some conversation and let's get on the same page so that every child can feel loved and accepted, and we can move forward together to affirm everybody. Thanks for listening. We'll see you next time.